Hi everyone, my name is Miracle Adele and I am a graduate student at Houston Christian University, and this is an assignment that is a video response for the course 6323 Counseling, which is Crisis Response and Trauma Care. So in our video, which is Needs and Challenges of Disaster, it is two women who are having a discussion. One is an interviewer, the other one is the interviewee. And she has been with this company for 5 years that services the community after disaster. So you would say a disaster therapist. The first question that we were needed to ask for this assignment is, what are the needs and challenges of the heroic phase? And so what I got from the video is that the needs and challenges of the heroic phase are denial of impact, taking extraordinary measures to protect, and that could mean the community themselves, their families, what's left of whatever the disaster may have impacted to its fullest. Any of those things could be being taken extraordinary measures. They stockpile assets. There's a lot of the community coming together. It's a lot of togetherness. But this entire process does cause exhaustion. Some people have different or adverse reactions to it. And then some people have the ones that was just previously listed. However, this is the time where the community is really coming together and trying to help protect each other. This goes into the taking the extraordinary measures, protecting their businesses, their homes, their families, and doing it together. But there's also a lot of denial of just how big the impact is individually. The second question is that the honeymoon phase can include a crash point, and so who, when, and why may this occur? From the video, it said a lot of unrealistic feelings may be during this phase. This could be from the fact of reality actually setting in, but there's also the fact of just major exhaustion for once you finally sit down, take a breath, and realize that this disaster has just happened, that you've tried to you've helped everybody out there in the community, you've done all that you can, and now you come home and you realize that this is also the scenario for you as well. So once reality sets in, the exhaustion sets in, and so for some people the honeymoon phase can be a crash point. The lady who was being interviewed, she said that in this phase, not everything is always warm and fuzzy. And you see a lot of physical ailments increase in this phase. She mentioned that for some people, they were concerned about heart attacks or having strokes, or just from either working in this environment or being a victim of the environment that this disaster occurred in. She said in the 5 years that she had been working for the company, had seen physical ailments grow higher and higher and higher the more disasters that had occurred to the same group of people or different people, just depending on how they would react to certain things. Lastly, the last question is, during the disillusionment phase, fear, anger, and hopelessness can set in. And so what type of clinical conditions may develop from these circumstances, and what treatment is best to overcome them? From the video, it did mention that a lot of people in this time are starting to feel hopeless or abandoned, fearful, angry. They have a lot of built up emotions towards exactly what has happened. In this time, severity does increase. It was mentioned that in this phase of disillusionment, you saw a lot of PTSD or a lot of anxiety, depression, that they deal with many cases, and those cases were upwards to 300 or 400 people a week that the company saw. She did mention that in the first 2 months of their company being open, that they did the marketing and did commercials for that, but shortly after that, all of disaster started hitting the Louisiana parish that she was servicing. Therefore, she had a volume that she is no longer able to control or cover all her bases. So she's focusing on, or was focusing on, the things that she could at the time. But she did want to mention that in between these stages, this is not just like a month to month or a week to week or a few sessions that, they get through these stages. It is more so that these stages are being slowly achieved over a course of years. It may take to the rest of some people's lifetimes, depending on the age in which the disaster occurred in their life originally. Um, some people need therapy, individual. Some people need group therapy. Some people need medication, depending on just the severity and how hard the body has taken a toll during that disaster, in recovering from the disaster. So in this video, the needs and challenges of disaster, many things was covered, and those things were over the heroic phases, the disillusionment phase, the honeymoon phase, and the reconstruction phase. The reconstruction phase is the post-traumatic phase. So there's a lot of growth there, but it's, post-trauma, post-disaster. And it takes time to get through all of that, and sometimes, depending on certain people's lives, if there's another disaster that may occur in that phase, they may slide back down the scale. But that was my understanding from the video, needs and challenges of disaster. Thanks for watching.